Come in.
Hey, Miss Smith. My name's Jody. I'm going to be your nurse practitioner today. I'm just going to wash my hands.
Okay.
So tell me about why you came to the clinic today.
Just for a yearly annual.
Okay. All right. Well, good. Let's talk about your past medical history. Have you ever had any surgeries?
Yes.
Okay. What surgeries?
Had a hysterectomy, partial hysterectomy.
What year was that?
06.
Okay. So you never had any hormone replacement or
No.
anything? Okay. Allergic to anything?
Penicillin.
Okay. Any other allergies, food allergies or anything? Any medications?
No.
Okay. Any herbals or vitamins?
No.
Okay. Any medical history? Any musculoskeletal problems in your family or with you personally?
No.
Okay. What about abdominal problems? Have you had any recent weight loss, weight gain, any problems with your going to the bathroom?
No.
Okay. Any kidney issues ever?
Mm-mm.
Step out, and I'm going to let you get undressed.
Okay.
You can put this drape over you, and then I'll be back and we'll get started with your exams. Are you ready?
I am.
Okay. So I am going to take a listen to your heart and lungs today, just to be sure that I don't see any problems with you
Okay.
today. Okay. We're going to start off with your abdominal exam. So I'm just inspecting the abdomen for symmetry. Her hands are down by her side. Just take a deep breath for me. Okay, let it out. The contour of the stomach is flat, so the contour, shape, size, and symmetry are all within normal limits. You can raise your head up just off the table. There you go. Okay, I don't see any bulges. You can lay it down. Muscles look symmetrical. I don't see any nodules or bulges or lumps or anything on the abdomen. Venous return patterns are normal. I don't see anything that would suggest pathology. So I'm just going to take a listen to your abdomen now. I'm going to listen in all four quadrants, so right upper quadrant. Okay, bowel sounds are normal. Hyperactive or hypoactive. I'm going to listen to your blood flow through your aorta, your renal arteries, iliac, and inguinal. I don't hear any venous hum. I don't hear any breweries. Do some percussion, and I do hear tympany over the gastric bubble where the fundus of the stomach is located. Overall tone and of percussion is within normal limits. And I'm going to percuss to locate your liver, borders, and your spleen. I'm going to measure it. And it's within an expected distance of 6 centimeters. Do you have any areas of tenderness on your abdomen right now?
No.
Okay, so what I'm going to do is some light palpation. So I'm going to press around on your belly about 1 centimeter deep, and then you just let me know if you have any discomfort or anything. Okay, now I'm going to do some deep palpation, and I'm going to use the percussions to kind of see if I can palpate your spleen and your liver. Normally I wouldn't be able to feel those, so you just let me know if you have any discomfort, okay? I'm just gonna lift up on your back. Press to see if I can feel your spleen. Okay, thank you. Locate your gallbladder. So I'm just gonna do deep palpation again, just below the border of the liver that was indicated. So I'm gonna feel for your aortic pulsation. It's normal. I don't feel any lateral pulsations that would indicate aortic aneurysm. So now I'm just going to kind of palpate for your kidneys. All right, and your spleen, just take a deep breath for me. Any pain or tenderness?
No.
Go ahead and test your costovertebral angle for tenderness.
Okay.
So I'm just going to hit there. Do you feel any tenderness?
No.
Okay. And I'm just inspecting your muscles and your musculoskeletal, your skeletal system. It looks like everything is symmetrical. Shoulders, skin folds, everything is symmetrical. There's no abnormality there. And just bend over straight forward as far as you can and touch your toes. If you can. Okay, come up about halfway. All right, then come all the way, rest of the way up. Okay, just lean back as far as you can with your head back. Good, okay, great. I'm inspecting the feet for weight-bearing concavities. Separate your feet for me just a little bit. So the spine is in alignment. I didn't see any lateral medial shifts to indicate scoliosis. You can go ahead and sit back down on the table. Okay, so we're going to test your range of motion. And first I'm going to ask you to move your limbs yourself, and then I will move them for you, and we'll see your range of motion. That way, go ahead and put your arms down by your side. Just take your, open your mouth for me as wide as you can. Okay, good. Close it. Now jut your jaw out, your chin, and bring it back. And then move your jaw from side to side. Okay, any pain or clicking or anything you notice with that?
No.
Okay, I'm just going to feel of your joint here. And this is your temporomandibular joint. Just open your mouth slowly. Good, close. No pain or anything?
No.
So I'm going to try to open your mouth and you just hold it closed for me, okay? Go ahead and take your chin down to your chest. Okay, now push it back. Lift your head all the way back as far as you can. Okay, good. Back up straight. Okay, turn your head from side to side for me. Good. Okay, good. Now put your ear to your shoulder like this. Yeah, okay. Okay. Now I'm going to put my hand there, and I want you to try to turn against my hand. So you can turn your cheek to that direction. Good. Okay. And try to push your head down. Okay, good. Okay, back. Good. Perfect. Okay. Now take and shrug your shoulders for me. Okay, good. All right, now try to shrug them again. Good. Okay, take your, I'm going to check your range of motion in your shoulders. Have you had any shoulder pain?
No.
Okay. Roll your shoulders in this way. Okay, roll them out as far as you can. Good. Okay. Lift your arms out by your side, just straight. Good, symmetrical. All right, don't let me push your arms down. Don't let me push them up. Okay, good. Bring them all the way up to your side, all the way up to your ears. Perfect, 180 degree. Okay, you can put them down. Okay, now put them out in front of you with your palms down. Okay. All right, now bring them up with your palms down, up by your ears. That's great, okay. Put them down by your side. Good. Okay. I'm just going to palpate and just make sure. Feel any edema, no tenderness, swelling, anything like that. In the cervical, I don't feel any of that either. No tenderness or anything?
No.
Flex flex your arms up with your palms and kind of touch your shoulders. That's good. All right, now don't let me pull them down. Okay. Now try to push them away. Pull. There you go. All right, good. I'll take your hands and put them in front here. Flip your palms over. Put them down by your side. Flip your hands back over. And then over again. Okay, good. I'm just going to palpate, see if I feel, this is the electron process, see if there's any tenderness or pain or swelling. Don't feel anything. Okay. Bend your wrist down like that. Great. Okay. Flex your wrist up. Great. Okay. Now, hold your hands straight. Bend your fingers down. That's good. You ever have any numbness or tingling in your fingers?
No.
Okay, flex them back as far as they'll go. Now move your wrists in. And don't move your elbows. And then move them out. Any pain or anything in your wrists?
No.
Push my hands down just with your fingers. Push your thumb up. Push it down. Okay. Good deal. All right, go ahead and lay back on the table for me, and we'll check your hip joint. We'll do the right side, and anything we do to the right side, we would do to the left side and compare them.
Sure.
Okay. With your legs straight, just raise it up as high as you can. Perfect. Okay. Hang down. Okay. Now bend your knee and raise it up as high as you can. Good. All right. Great. Go ahead and bring, with your legs straight, bring it out away from your body. So this is adduction. Great. You can put it back. Take the same leg with it straight and put it under your other leg as far as you can, going in toward. That's adduction. Okay, good. Okay, go ahead and bend your knee for me. And put your foot flat on the table. There you go. Just let your knee fall in toward your body. Okay, and now out, away. Great. Okay, perfect. I'm just going to palpate your hip area. But now I'm going to raise your leg up for you. Just relax. Raise it up. Good. Okay, try to push it down. Good. So your knees look good. Just checking for any edema or any bulging or anything. Ever had any knee problems?
No.
Okay. Feet and skin looks symmetrical. There's no abnormalities with color, contour, or shape. Okay, so flex both of your feet up toward your head. Okay. Now flex them down away from you, like pointing your toes. Okay, good. All right, just relax them. Now try to do that again with me, putting pressure on. Great. You're going to turn your feet in like that. Great. Now turn them out. Perfect. So non-weight bearing concavities appear normal. Go ahead and flex your toes for me. Flex them in and out. Good. Okay. Now turn your toes in. Pull your toes together. Okay. Now pull your toes out. Good. Perfect. Okay, feet and ankles appear to be in line with the tibia and patella. Okay, well that concludes the exam. So what I'm going to do is step out and let you get dressed, and then I'll come back in and talk to you about our findings and what we can do for you, okay?
Okay. All right. Thank you.
You dressed?
I am.
Okay. All right, Miss Smith. Well, thank you for coming in. Let me do your exam today.
Yes,
Everything looked good. Didn't see any areas of concern. Just make sure that when you're at work, you use proper lifting techniques. You lift with your knees and don't lift with your back, and that'll hopefully help prevent you from having any kind of muscle strain injury while you're at work. Do you have any questions for me or any concerns?
No, I think I'm good.
Okay. Well, thank you so much. I appreciate it.
Thank you. Have a good day.
You too. Bye-bye.
Bye-bye.